All right, so Professor Sandeep, that was phenomenal. I think I come into existence after the pilotitis is cured. I mean, I completely, echo your sentiments. I mean, even my day job is to write checks into startups, especially that are into intersection of AI, healthcare, anything to do with automation and anything that can help improve the care. And even for us, after the pilot is done, after the data is tested, everything is done, um, close to, anywhere between 60 to 70% of startups tank, and they don't do anything measurable, anything that is definitive. So thanks for highlighting. My name is Raghav. It's a little complicated South Indian last name. It's called Hunasgi. And my day job is I'm a CEO of a public listed company called String Metaverse, and I run a fund called SR Capital. Prior to doing both of this, I founded a company which became a unicorn, but that was in crypto, and thanks to President Trump for making all the crypto companies go there. I mean, so we exited the company at at a 2 billion valuation before we started this. I wouldn't bore you guys with all of this. I know you're very knowledgeable. I know you understand all of this. The only takeaway from this slide is AI will have a larger impact on healthcare than the internet itself had, and I'm sure hospitals like Yashoda and doctors and practitioners here will agree with what I'm saying. So, I mean, as a VC, as an investor, as somebody who is building, Vault is a platform that we are building. Vault is a AI platform that helps practitioners, that helps patients, that helps diagnostics, and we are building the product is at the intersection of all three of this. And while we are building that, one thing that we have seen is it's not the number of more patients that I can see, or the number of sessions that I can have. Some of the major problems are physician burnout, especially in countries like India. I know, thanks to all the physicians, all the doctors in this room, we know the kind of burden you have. Second is the nursing shortage, especially if it is to do with the public health. Third one is the healthcare costs. I was reading a report which says India is probably in the bottom 10 when it comes to insurance and insuring for healthcare needs, aging population, delayed diagnosis. So these are all the problems that we are solving. One major thing that before we started Vault, or before we invested in the AI company, was we were asking what is that one problem we can solve that will make this product shine. And the problem was very simple. How can we reduce the admin work that the doctors and practitioners do? And that's exactly what we are trying to address here. This is basically talking about the numbers and forecasts of where AI in healthcare is heading. I'm sure we all have been reading about NVIDIA, we've been reading about OpenAI, we've been reading about the significant investments in AI that is happening, and we are estimating this to cross 500 billion. And these are all the numbers that, all the stats have been taken from all the leading, analyst reports. So there are 5 pillars that, AI and our portfolio companies, Vault as an organization, is trying to address. One, diagnosis. How can we make diagnosis faster, earlier, and more accurate? Again, echoing with what my fellow speaker, Dr. Sabeen, was talking about, the 3 A's. The second is treatment. How can we build more evidence-based models that will help and enable physicians to do probably procedures, diagnosis, all of that faster and better. Operations, obviously, Professor Sandeep almost gave the whole Bible of operations, so I wouldn't talk about it, but automated workflows and how can we make sure that we are optimizing the resources is what we are looking at. Drug discovery, obviously, I'm sure a lot of you have seen all the data that is flowing around, and I'm sure there is a Netflix documentary that is coming on how drug development life cycle is getting shortened from 5 years to 5 weeks to 5 months. And then personalized medicine. We also invested in a bunch of longevity clinics and longevity practices. One of that is called Ritayu, which is well positioned to be India's largest wellness and longevity group. And that's where the whole personalized medicine game comes into play. Where does the AI fit into this whole ecosystem? The traditional is obviously patient, doctor, and decision. And AI comes right after, once you have the variables, once you have all the sensors, once we know that all the data is pushed. It enables doctors to do better decisions. So AI comes between the doctor and the patient with all the sensors, all the variables, and all the data that we get. Some of the things that we are doing, I mean, the areas that Walls today and all our partner companies are covering is in the area of radiology, pathology, cardiology, dermat. Dermat is big, and then also we are working with LV Prasad and few other organizations. So what is the difference between why doctors with AI and doctors? And I wouldn't want to make this statement, but there's a very famous statement that OpenAI put out the other day in the healthcare conference, which says AI is not here to replace doctors, but there is going to be two set of practitioners. One, the doctors who harness and leverage the power of AI versus the ones who don't. And that's what we are focusing on. How can we build models? How can we build intelligent systems where doctors don't have to use keyboards, type, write anything? You're speaking, you're having a free flow conversation with your patients, and your AI is doing all the other admin stuff, be it creating a discharge summary, be it creating notes, be it doing intelligent analysis and doing recommendations, all of that. And that's what we are doing. So we have built listening engine, we have built documentation engine, working on how summaries are done. Obviously, we don't want to enter into recommendations. AI would not recommend, but based on whatever the conversation between the clinician and patient has been, AI will give you a meaningful inference on what are the next steps. So there's obviously a significant amount of research done in automating and creating AI nurse. Again, OpenAI has put in a significant chunk of money. I know Google is a sponsor here. Google is also my ex-employer. I worked at Google in the early days of my career. But Microsoft has pumped in a significant amount of money in creating AI nurses. Again, the goal is not to replace human nurse, but how do we make them more efficient? How do we make them do better work without getting burnt out? And that's what OpenAI, Microsoft, and some of our organizations are partnered in building. What we are talking about, what we're doing is how can AI simulate outcomes even before the treatment is given. And this is super personalized. This is not a generic simulation. It is the simulation goes down to a level of that particular person with his whatever ailments and his condition and all of that. And once the simulation is done, it gives a recommendation whether this will work or if there is any other alternative that we should be using. The future of personalized medicine, we have recently invested in Spain in a place called Marbella, where they are piloting one hospital with 50 beds, 2 doctors, and roughly about 600 AI agents. This is more of a wellness hospital. It's not a critical care hospital, but the experimentation there is how can a person or a patient walk into the hospital, interact with agents, and see if they can walk out with just one interaction with the doctor. And the whole essence and the point there is, can we enable doctors to focus on what is more important and more critical? There are a lot of people who walk in who would say, I have heard of this new peptide that is coming up. I have heard of this new GLP-1. Should I be taking it? Probably AI is better trained to handle all of that. And if there is any critical need, that's when doctor gets involved. So the future of personalized medicine especially is going to be, going to 10x with, the advent of AI and how AI is going to help. Healthcare used to be infra heavy as a business. We had invested in pre-AI era in the healthcare as well. There we spoke about the sophistication of the OTs, the medical devices, the infrastructure, and all of that. Now the new age investment thesis for any venture capitalist or new age thesis for anybody who's looking at building something in AI is data and intelligence. Obviously, infra will continue to remain, but infra will not be the central part of any investment thesis. It will be the amount of intelligence and data. I have my CTO here. We are more than happy to walk you through on what we are doing in our labs in Singapore and US at Walt. But what we are doing is we are building a data lake. We are building a layer where the goal is to connect the lab to the patient, to doctors, to pharmacy, to research, and how can we make all of this today? If Blinkit, if a Zepto can do deliveries in 10 minutes and do a lot of this, how can we help and enable medical practitioners do things at a lightning speed? Obviously, I don't intend to say we want to do anything delivery in 10 minutes, but that's the goal with which Vault is building. We have a lab and a research facility in Singapore, and Hyderabad is our home for the the India Center. I'll skip through the compute. I'll skip through all the AI stuff that we have seen because I know I have just 2 minutes left. What I want to come to is there are three critical elements that agentic economy or AI economy is going to look at. One, physicians and practitioners can never be replaced. I mean, this debate has been going on for, I think, from the time the first AI model was released till now, and guaranteed and written on stone that no AI model, no intelligent model can replace physicians and doctors. The AI models can only help them make more, better informed decisions, and help them equip to probably do, provide more personalized care than they used to, but otherwise, doctors will continue to play a pivotal role. What AI is going to do is AI is going to be more from a patient standpoint, from an end customer standpoint. The experience is going to be more seamless. Wow. So the Marbella hospital that I was talking about is, we have built an alerts and notification module where there is integration with a lot of other apps, where the cab is booked or your flight ticket is booked. If you're going from India, there's a concierge service that takes you. There's a person that meets you and books everything in the hospital. You walk in, you get your treatment, and you walk out. And that's what we have piloted and have seen working phenomenally well. But once again, thank you so much for all the medical practitioners, all the doctors here for doing the fabulous work that you do. And thanks for enabling AI to probably help you serve more patients. Thank you.